Good evening, everybody. Thanks for joining Dr. Sharma's show today. I'm your host, Dr. Sharma. I am board certified nephrologist and metabolic health expert, and I here bring you every week some new health insights. So if you're looking for health related advice, then this is the right site for you. Today we have a very special guest. Surura is the functional wellness coach and avid traveler. She views the skin as not just a surface, but a vital reflection of our overall wellness journey. So we are going to talk about how your inner wellness is related to your skin. With her first-hand success and functional wellness knowledge, she has coached countless clients towards smoother, radiant skin, better sleep, release of extra weight, and confidence. She's excited to partner with you on your journey to uncover the root cause of your inflammatory skin issues and achieve the better health you can have. So let's invite Dr. Surura for this discussion. Let me see. She should be here. Good evening, Surura. How are you?
I'm doing all right. How are you?
I'm good. Thank you for connecting me here with me today. I'm sure our audience will have a lot of nuggets from, they can gather from you about having a clear and, clear and healthy skin with the overall wellness. So I'm really excited about our topic today and welcome. So
Thank you.
tell us a little bit about your background, about your story.
So, my background started with actually biochemistry. So, I have a master's degree in biochemistry, and I worked in biotech for about 7 years. But I always loved medicine since I was a child. So, I went back to medical school, and I practiced for a while in dermatology and general medicine, then transitioned into functional medicine. And now I practice as a coach because I see that helping people understand their lifestyle choices is very important. So, I'm a coach. And my story is that at the age of 12, I developed eczema, and I dealt with that for years into my early 20s. But along the way, I realized that this has to give. I was tired of putting the creams on day and night. And I said, look at what else I could do in my own power to change what was going on with me. And I realized that my lifestyle choices, my food, and all that stuff was affecting me. And so I backed off and I just started to be more aware and listen to what my skin was saying. And I haven't had any outbreak in over 25 years.
Wow, that's a very powerful message right there. This is a live chat. Feel free to put any questions you guys have. Sura, I'm really glad that you overcame your disease. I know eczema, people are now using biological and all those creams and injections. So you claim that you can have a clear skin without injections, without any medications. So tell me how the inner wellness and your health is related to your inflammatory skin condition.
So the biggest thing like I understood with functional medicine, because I did that back then without even understanding what functional medicine was about. But I just my intuition was like something is not right. I might have this because I was told that this is genetic, so I have to live with it for the rest of my life. I said, okay, that's fine. But what can I do in my own power to make it better? Because I was tired
Mhm.
of terms of myself. So when you look at the gut health is, I call it the powerhouse. Whatever happens in the gut does not stay in the gut. So the gut is where a lot of molecules, a lot of nutrients are made. When you eat, you have to have digestion in the gut. If it's not functioning right, you don't have the nutrients that your body needs to function. And also, if you have any kind of inflammation that will cause a leaky gut, or you have the intestinal permeability, now you have a leaky gut. Now the food is not going from the stomach into an intestine into the bloodstream. The body does not know the difference. So it thinks it's stranger danger and starts to launch inflammatory attack on the body. And all that increases the cytokines, which now goes and affects everywhere else. So now you have oxidative stress, you have hormonal imbalance because you're not having your nutrients, and also you're also having this inflammation going on at the same time. So that starts to cascade and affect everywhere else. And then if you also have problems with liver detox, guess what is happening? You're not getting rid of the waste that your body's making. So let's say your body breaks down the estrogen because you have excess estrogen, because the body recirculates all these molecules. But now you have estrogen that's broken down and needs to be getting rid of, but now the liver is not functioning well. So now, and then you have the estrogen dominance, excessive estrogen in the body, which causes havoc, affects your whole hormone balance. So this just goes on, affects the nervous system, affects the mitochondria. There's a skin gut connection. There's a brain gut connection. It's just all this cascade. I always say the body talks. They talk to us and they talk with themselves. The organs talk to themselves. So when these symptoms are not working right, no matter whether it's medication, no matter whether it's genetic or not genetic, it doesn't matter because we are not giving the body what it needs to thrive.
Okay. Wow. That is very powerful. I think, yeah, you're absolutely right. So what I'm hearing is that your skin conditions can start from your gut dysfunction and can start if your liver is not functioning right. And that cascade can cause hormonal imbalances and other chronic conditions, which can actually present themselves in the form of skin disease. Is that right?
Yes,
Okay.
it's a cascade.
So if you have a patient who's coming to you with some kind of skin problem, it could be anything. It could be psoriasis, it could be eczema, or just a rash. Like, how do you start that workup for those patients in your coaching program?
So what I usually do is I have like a nutrition assessment questionnaire that they answer before they even see me, and I look through that, and that kind of gives me an idea what part of which system is not working right. Am I looking at the gut only? Am I looking at digestive, as in detox pathway that's not working right? Is it the nervous system? Is it a trauma that happened? Is it more of a mindset of something that's going on that's stressing them out? Is it a stress at work? So I look at that ahead of time before they come to talk to me, and then we sit about 60 minutes and we just discuss what it's been going on. So I look at their life, their timeline. Like literally from when they were born, where did they live? What do they live now? What's going on? When did this all begin? It is a family history. Yes, I get that. It's genetic, but it's also epigenetics. What else are we doing to contribute to the genetic predisposition? So then based on their lifestyle, based on the history, based on the timeline, then we can start talking about lifestyle choices. For instance, I had a lady, I'm just calling her Nancy. She came in having breakouts all over her face. She doesn't sleep well. She has a hard time falling asleep. She has a hard time staying asleep. So after discussing with her, I realized she must have some cortisol imbalance. And what we talked about was what can we do to help her out without any supplements, without any medicine at all. It was just trying to see how can we get her to get 7+ hours of sleep a night. So we had a sleep routine that we put together and said, okay, this is what you need to do. Dim the light, turn off the electronics around this time. She likes to drink wine occasionally. Okay, that might not be helping. Stop that actually at night. And lo and behold, within 3 weeks, she was sleeping better and her skin started to clear. 6 weeks later, she had no breakouts like she was having before. She was sleeping better. She had more energy, and she was able to focus better. So those are just the lifestyle aspect that we look at. Because what we do on a regular basis that we don't pay attention to, as a coach, when I listen, not only do I pay attention to what they're saying, I guide them on how they're going to modify without being overwhelmed.
Right.
Because a lot of people get overwhelmed is when we don't do anything at all. We started and we just stop because we don't have any support system to help us or to guide us, and just we think something's wrong with us. But it's just having somebody to listen to you and see what you don't see and guide you to your goal, basically.
Yeah, so many times, all of us know that how to sleep, right? So the sleep is important, but we are not overlooking the details of how we are sleeping. And some people, they recommend, like in my practice, I use Aura Ring. That gives me a lot of insight about your sleep cycle, how your stress level is, how your heart rate variability is. And if you're, because, sometimes we just say, oh, we are sleeping 7-8 hours. Like I am in bed for 9 hours, but my good sleep is only 6 hours, right? So you might not have maybe you have obstructive sleep apnea, maybe you have other problems which is interfering with the good night's sleep. So just the solution of having a good sleep can bring you a good skin. So that is fantastic. What else have you seen in your coaching? Anything striking out with any unique patient you had you want to discuss?
Yeah, for me, so when it comes to the skin in general, I think when I was in regular derm, I did not understand the importance of the gut. And during my studies doing functional dermatology, I realized that 99.9% of people that are coming with one skin issue or the other have a gut dysbiosis. Something is going on in the gut that's not where the terrain is not where it's supposed to be. So either they have overgrowth of bacteria, or they have normal bacteria that just decide to just act crazy, or they have a parasite, or they have candida. And that was for me very surprising. And I've seen that in all of my clients also is we're not aware of it. So we think we can just put a cream on our skin and everything's going to go away, inject this, laser that. But when the terrain is not working right, no matter what you do, it's gonna come back. So
Right.
for me, I realized that and that's the thing, that's the reason why I am in where I am right now, because I realized that ahead of time, but now I had a better understanding how important the gut health is. And that supports everything else. So in my clinic in general, actually I had a client that came in, some acne, some weight gain, fatigue, joint discomfort. But more than anything else, she had difficulty conceiving. She had 2 miscarriages. And I was like, okay, I don't do fertility. That's not my thing. But let's talk about lifestyle. What can we do with lifestyle? So we changed the lifestyle. We looked at sleep. We looked at, nutrition. And lo and behold, 3.5 weeks later, she got pregnant.
Wow.
And I was just like, to me, that was amazing. Like every day I'm surprised when I help clients and I guide them and I see the improvement. And because at the end of the day, it's not about me, it's about them. It's what they're willing to do based on what I tell them. And so I'm always surprised.
That's wonderful. And I'm sure your client must be very happy with what you did. And nevertheless, you're not fertility physician, but you guided her in a right direction, and that helped her. That's fantastic.
Yeah.
Now, when the patient is coming to you, what blood tests do you start looking at for those? You mentioned about nutrition. So you do like the vitamins and minerals testing to see if they have any deficiencies?
Not right away.
Okay.
Again, I always go from the gut because I was looking. If I look everywhere else, the gut for me is always the first. So if they have a blood work that came with them, usually they do from the primary care doctor because I'm not a primary care doctor or a doctor at all. When they bring the lab, I can analyze it and review and say, oh, just review and say what's going on, what's not working right. And a lot of times I don't even need the lab initially. Just the NAQ is enough for me to get an idea of what's going on with them because that's actually what they're feeling, how they're doing. The lab is a microcosm of a moment in their life that they did a lab. And whatever
Right.
they did that day might affect the lab results. So I go by the NAQ. And based on the NAQ, they have labs, I'll look at it. If they don't, I don't really need it as much. I want to look at the gut health. So I do a stool test, an organic,
Mm-hmm.
and those
And
stool tests,
how do you evaluate for the gut health?
I do the stool test. I do a stool
Okay.
test. Yeah, the stool test will give me an idea what's going on. What is the terrain? What's going on in that village? I call it a village. Is it all the bad guys or the good guys? Or are the good guys becoming the bad guys? And based on
Mm-hmm.
that, how do I support this person? The organic acids actually supports the gut, the stool test. They kind of like work together. So I can say, okay, somebody has candida, somebody has H. pylori, somebody has this. I'm supporting them initially based on their NAQ. How can I give them rapid relief? How can I make them feel better? Then we start looking at dealing with what's going on in the gut. How can we make the terrain, the village better, more comfortable before we start bringing more things in? So like, so for instance, right now, somebody is deficient in magnesium or maybe in iron, but no matter what we do, no matter what they eat, they cannot absorb it. Adding more supplements is not going to make a big difference, in my opinion. So I need to kind of support them some to get some nutrient in them, but more than anything else, get the gut terrain doing better. So when we give the supplements, it can actually absorb and do its
Right.
job.
That's wonderful. That's fantastic. Can you share the example of how improving, you mentioned about the stress and sleep. You shared the example of your one of the patient who had sleep disorder and found to have skin dysfunction. How does the increase in cortisol? I'm just wondering because I'm also a metabolic health expert and I'm looking at, the overall cardiometabolic health. And what signs or symptoms should I be worried about when it comes to metabolic dysfunction in somebody who is presenting with skin problems?
So it depends on what they're presented with, first of all. So when it comes to acne, maybe melasma, rosacea. Rosacea, we're looking at more like SIBO happening with them. That's very common. A lot of studies have found that. When it comes to psoriasis, again, gut imbalances, sometimes H. pylori, same thing with acne, candida, parasites. Those are the things that we can be wondering about when you see that. When you talk about cortisol by itself, cortisol, I always say hormones that communicate. So one is off, the rest are going to be affected. So when you have excessive amount of cortisol, it increases your stress level, which causes more inflammation. It also affects insulin resistance, which affects the causes more metabolic dysfunction on the other hand. All that affects the skin because the
Yeah.
skin out is the inside out of the gut. So when there's high cortisol, high stress, affecting sleep, when the body's supposed to regenerate, you have a high cortisol at night, so you're not sleeping well, so you're not regenerating. But on the other hand, if you have more stress, more oxidative stress, more inflammation, more cytokines, it's just like this circle that never ends. And that then also affects the immune system, which people with psoriasis can have issues with that. So when we have the gut dysbiosis, because the elevated cortisol also affects the gut. So with the gut dysbiosis, the increase in cytokines, with the increase in LPS from the bacteria because of the overgrowth, now causing more inflammation and autoimmune diseases. So it's a
Right.
circle that just keeps happening.
So it's interesting, like in diabetes, sometimes we see that dark pigmentation around the neck. That
Yes.
is usually the first sign, like even in pre-diabetic patients and metabolic dysfunction, if they have metabolic syndrome, we see those darkness, and that is like the first skin sign you can look into those patients with metabolic problems, right?
Yeah, you see
That's
that around the neck. You see that in the armpit and the knuckles, sometimes on the knee. That is one of the other sign that people don't talk about a lot is skin tags.
yeah,
So skin
yes,
tags and the we call it barnacles, dermatosis, seborrheic keratosis. That is also a sign of insulin-resistant metabolic dysfunction.
yes. So
That's not
that
talked
is
about.
all telling you there is insulin resistance. Do something at this point before it gets out of control.
Yes, and
So that's wonderful.
melasma also can show up as metabolic dysfunction, hormonal
Yes,
dysfunction,
yes.
imbalance, liver detox issues.
I remember 20 pounds when I was during the pandemic, I gained 20 pounds. I was having a lot of melasma, especially around my neck area. So that was concerning. And when I looked at that from metabolic perspective, I talked to myself, I have to do something now before it gets, to the point that it's not reversible. So and I think it's very insightful for people who are listening to look for those signs, initial signs for insulin resistance, metabolic dysfunction into their skin. And those are the subtle signs they should be aware of. And thank you for educating everybody about those. So anything else you want to add, like a simple lifestyle approach they can take to avoid having skin issues? Just 2 or 3 points you can give it to our audience.
Okay. So one that's very important is hydration. And when I say hydration, not just any water, just be water to make sure your body actually you're drinking enough water and you don't feel thirsty. Because sometimes people have cellular dehydration. So I like my water, clean water, and I put some electrolytes in it. Sometimes if I don't have electrolyte, I put salt in it. But not everybody needs that. Some people depending on what kind of water you're drinking. So hydration is very important. Sleep is very important. And sometimes I think that might be hard to do. Yeah, it is sometimes in our rat race world. We just have to take one step at a time, just minimize certain things, and just I always go from one week to the other. What is my goal? I want to add 30 minutes. I want to add 15 minutes. Maybe turn off the lights earlier. Maybe put the computers away earlier. That's all you need to do. You don't have to do go from 5 hours to 7 hours the next day. It's not going to happen. The third one is more about gut health, and it has to do with digestion. Because when we talk about digestion, we talk about what can I do about my gut. But sometimes we just need to start by eating hygiene, chewing your food 100%. So let's say every bite, about 30 chew per bite. That's something that everybody can start doing today at dinner time. Just make sure you chew your food all the way. I think that's very steps to just take right away. That will help because if you chew your food very well, you get the enzymes in your mouth to do its job. You get the gut to do its job. Then you have less issue of getting dysbiosis, of getting LPS into your bloodstream, of getting other issues that will cause autoimmune disease. So those are just very simple steps that I think everyone should do. I am aware of that, and I try to do that every single day.
That is absolutely true. And there was a study which was published which showed that people who don't chew their food and just gulp it down, they have 4 times higher chance of getting metabolic dysfunction. So you're absolutely right. Your digestion actually starts from your mouth, and be mindful, be present with your food, and that will activate all the enzymes, all the digestive enzymes in your body, in your mouth to help you digest better. So thank
Absolutely.
you for sharing those nuggets, Surar. I really enjoyed our conversation today, and I'm hoping I wish you all the luck
Thank
for
you.
your practice, for your coaching. How do our audience reach you?
So my Instagram handle is at Sururat Coulibaly, at Sururat Skin Coach. That's where I am. So you can reach me there. Message me if you have any questions. And my website is theholisticskincoach.com.
Wonderful. I'll share those links as well in our show notes. Thank you for connecting me with me today, and I really appreciate your time. You have a wonderful night.
Thank you, Dr. You have a beautiful day.
Bye bye.
Bye.